In 1793, the yellow fever epidemic of Philadelphia killed over 10% of the city's population in just 4 months. The cause of the fever was unknown. Benjamin Rush, a well-known doctor in Philadelphia, had a theory on the cause of the fever and methods of treating patients. As a leader in the fight against the yellow fever epidemic, he theorized that the illness was caused by the unsanitary conditions of the waterfront. His methods of heroic medicine included blood leaching and intestinal purging. Dr. Rush led other doctors to treat the sickness in the same way. His methods helped to save over 6,000 people, including himself. Although Dr. Rush's life of heroic medicine was later found to be harmful, he went on to accomplish many great things in the field of medicine. His legacy as a father of American medicine still influences how doctors treat patients today. Benjamin Rush was born in 1745 and raised in Bryberry, Pennsylvania, a city right outside of Philadelphia. At the age of 6, his father died and left his mother to raise 6 kids. To support her family, she ran a grocery store in the town. Samuel Finley, Benjamin's uncle, took on a father figure in Benjamin's life. Samuel was the president of what then was University of New Jersey, but today is Princeton. In 1760, when Rush was 14 years old, he became the youngest graduate ever of Princeton. He graduated with a bachelor's, but under his uncle's influence and his interests, he moved to Philadelphia and began training to become a physician. In Philadelphia, Rush met a leader in the medical field named John Redmond, who told him that he saw potential in him and suggested that he go to the University of Edinburgh in Scotland for his doctorate. Because of his travels around Europe, he was acquainted with Benjamin Franklin and they became lifelong friends. He came back to Philadelphia in 1769 and became the first professor of chemistry at age 23. Rush not only was a well-known doctor, but also a politician and reformer. Rush officially put his name down in history when he signed the Declaration of Independence in 1776. Dr. Rush's leadership lies in what he did the last 20 years of his life. In 1793, a deadly epidemic called yellow fever spread across the whole city of Philadelphia. Many thought that it was contagious, and if one of their family members caught it, would sometimes throw them out on the streets. People in 1793 just categorized the beginning symptoms of yellow fever as symptoms of a regular cold, but it was not just a regular cold.
There wasn't a lot known about the causes of the disorders.
After the first phase of yellow fever, the symptoms enter a toxic and deadly phase. People would experience yellowing of the skin and whites of their eyes, hence the name yellow fever. On top of that, they would experience abdominal pain, vomiting, normally and of blood, bleeding from the nose, mouth, and eyes, liver and kidney failure, delirium, and seizures. No one knew for sure what was causing the fever, but people had theories.
Yellow fever was an epidemic. It had been historically something that had been very, very serious.
Benjamin Rush had a theory that it was being transmitted through the air from the waterfront. Nobody thought that he was right, and he wasn't, but he still continued believing in his theory and started creating more ideas regarding yellow fever. Dr. Rush had his own way of treating the epidemic. He used what was called heroic medicine. People were desperate for a treatment and answers, so Benjamin received many followers who would use his methods.
At that time, bleeding was very popular, and one of the reasons for it was that the theory was that disease might be caused by too much inflammation of blood vessels. So you were then driving off an unhealthy substance by bleeding.
Rush thought that African Americans couldn't get the virus, so for a while he led the Free African American Society to spread his treatment methods. But the African Americans started to realize that he was wrong when African Americans started to get the virus. Doctors in Philadelphia kept using his methods and saved over 6,000 people, including Rush himself. That practice continued for many years later. In fact, in 1799, Dr. Rush's practice of heroic medicine was used in an attempt to save George Washington's life. As George Washington lay sick and dying, doctors came and gave him mercury compound to make him throw up and clear his digestive system and took 5 pints of blood from his veins. George Washington died later that day. That same day, Benjamin Rush was in court for a malpractice case defending the methods of heroic medicine and was found not guilty. Rush influenced several generations of physicians who used his methods to treat similar epidemics into the 19th century.
Rush was famous for his Rush pills that were mercury containing. The use of the mercury lasted much longer than a specific use during the yellow fever outbreak. It was used for a lot of things besides yellow fever.
The legacy that Rush leaves behind is not defined, however, by how he used heroic medicine to treat plagues. It is defined by how he used heroic medicine to treat mental illness. In 1787, he began to work with patients at the Pennsylvania hospital that were suffering from mental illness. At the time, people who suffered from mental illness would be imprisoned and punished for the actions of insanity.
Psychiatric patients were placed with prisoners who were lawbreakers at the time. And it was very common for patients to be restrained. Benjamin Rush was pretty enlightened, felt that that was not necessarily anywhere near an adequate way for people to come back to their senses.
Rush thought that insanity was a disease and not a crime or unearthly possession. This theory showed a huge advance in the understanding of this subject. He believed that mental illness could be treated with heroic medicine. Benjamin thought that mental illness was caused by irritation of blood vessels in the brain. Though he strongly believed in bloodletting and purging, his treatment was considered more humane than other practices that were previously used on the insane. Other than bloodletting, purging, and hot and cold baths, he also designed a tranquilizer chair for the purpose of treating mentally ill patients. The chair was designed to control the flow of blood to the brain and reduce the frequency and force of the pulse by controlling muscular action and reducing motor activity. Benjamin helped the idea of mental health come into the field of medicine.
The person sitting there has restricted vision. The philosophy being that they were trying to deal with overexcitement, which is another theory of why people developed illness or psychiatric illness.
A year before Rush's death, he published the first psychiatry book written by an American. It was titled Medical Inquiries and Observations Upon the Diseases of the Mind and was published in 1812. From then to 1835, the book went into 5 editions and served as a major textbook for almost 50 years. In 1844, around 30 years after Rush's death, 13 superintendents formed a group that today is known as the American Psychiatric Association. Their association's emblem has a picture of Dr. Rush on it.
Benjamin Rush was the first leader of that organization, which then became the American Psychiatric Association. And the idea was to provide humane treatment and also for people to be active. The men, the women had tasks to do so that they had a sense of purpose. And that's very, very important.
His legacy lives on today as being the father of American psychiatry. Benjamin Rush changed the face of American psychiatry forever.